Hello, my name is Karen Mariner. I'm a licensed health insurance agent in the state of California. I specialize in helping individuals and families find affordable, high-quality health insurance, and I work with my clients all year long to advocate for them. That includes finding providers, working claims issues, helping with family transitions, and in general, helping people figure out this very, very confusing market that we have. Today's webinar is specifically about the Obamacare subsidies. Our exchange here in California is called Covered California. This is an updated webinar because we have new plan designs coming in 2017. So what does it mean for a plan to be an Affordable Care Act, also known as Obamacare plan? It means that there's no medical underwriting, so no insurance company can ask you any of your medical history and then decide what to charge you for a premium. It means that preventive care is covered at 100%, that there is no maximum annual or maximum lifetime benefit. It means that every plan has to have a specified maximum out-of-pocket for the year so that you know when you're buying that insurance that the worst case scenario is, let's say $6,000. You could have a problem that costs you $500,000 at the hospital, and you're responsible for $6,000. That's a very, very important piece of the Affordable Care Act. And that mental health has been brought into parity with physical health, so that paying for a mental health visit should cost exactly the same as paying for a physical therapy visit or a doctor's office visit to go for your annual, or that's not a good example, but a doctor visit because you're not feeling well. So this is also a super important part of this law. And that there are these standardized metal tiers from bronze to platinum to try to make sense of this really complicated market. All of the plans are organized into these metal tiers. And here they are. So the lowest metal tier is the bronze tier. That 60 number, that's an actuarial average of how much the plan pays versus how much the consumer pays. And that means that, let's say you took 10,000 people and you put them on a bronze plan for a year. On average, the plan pays 60% of the cost and the consumer pays 40% of the cost. Bronze plans are high deductible plans, so they're really not particularly comprehensive, but they're affordable and they're still going to be there in the event of a catastrophic situation. So you can see the schedule of copayments in a bronze plan. There is a limit in a bronze plan to the number of visits you can have at $75 a piece, and that is 3. In any given year, you can see primary care, doctor, a specialist, or urgent care for a total of 3 times before you have to satisfy the $6,300 deductible. Bronze plans in California, and I should say these are California benefit designs. I really can't speak to benefit designs in other states, but they should mirror these to some extent. The max out-of-pocket on a bronze plan is $6,800. And as I said, the average cost share is about 40%. There is medication on a typical bronze plan is covered after a $500 deductible. Silver plans feel a lot more like group insurance or employer-based insurance, and they are the most popular plans across the country. In 2017, primary care doctor is $35, specialist is $70. The urgent care has come down. If you'll notice, they now have decided that the consumer is better served if urgent care and primary care have exactly the same copay, and that's been changed across the board. Max out-of-pocket is the same on bronze and silver, and on average, the consumer pays 30%. There are some more nuances. For example, there's that $2,500 deductible on a silver plan. However, very few services require that you meet that deductible. For example, being admitted to the hospital requires deductible, but emergency room doesn't. And this is the first year where emergency room hasn't required the deductible be satisfied. Medication, doctor visits, outpatient procedures, none of that required a deductible. Brand name drugs do have a $250 deductible, though. The Gold plan has no deductible. The office visits are slightly lower. Again, your primary care doctor and your urgent care visit have exactly the same copayment. But you can see kind of on down the line, slightly lower out of pocket maximum, but very, very close, $50 difference, not huge. There is no deductible for out-of-network care either. And so when clients of mine know they're going to be using out-of-network care, they tend to choose a Gold plan. And then Platinum is generally for the chronically ill. It's the most expensive plans on the exchange. And by the way, all of these plans are available through our Covered California Exchange or directly with the health plan. If you're not eligible for a subsidy, there's not a lot of reason to go through Covered California, and we'll talk about that in quite a bit more in depth. So you can see that there are no deductibles for drugs, for a doctor, for a hospitalization, and on a Gold or a Platinum plan. Now, I keep saying subsidy. What do I mean? There are essentially three types of subsidies. There's tax credits that are given in advance so that you don't have to pay the whole premium. You sign up for a plan, you're eligible for a certain subsidy based on your income forecast, and then Covered California pays their piece, you pay your piece, and it gets reconciled on your tax return. There's another kind of subsidy called the cost-sharing assistance subsidy, and this is when your income is in certain brackets. You're actually offered a plan that's called an enhanced silver plan that has lower copayments, lower deductibles, lower maximum out-of-pocket than what we just looked at on that Silver 70 plan. And I'm going to talk about those in a couple of minutes. And then there's Medi-Cal, which is the California version of Medicaid, the health insurance plan for low-income Americans. Adult consumers with taxable income below 138%, which is about $16,300 right now, are eligible for Medi-Cal. There's no asset test. It's all based on an income forecast for the current year. What's confusing for people is that the Medi-Cal income requirement for juveniles, that is under 19 years old, are much, much higher than for adults. So the adults in a family could be eligible for an enhanced silver plan with their income, but if they are, the juveniles in their household will automatically be eligible for Medi-Cal. And so these are the things that I keep in mind with my clients so that we know if you don't want Medi-Cal, we have a different strategy. To basically get the adults on the enhanced silver plan and then pay retail for the kids. More about that later. So what are some of the types? I keep saying taxable income, income forecast. Subsidies are based on the year that we're sitting in. So 2017's subsidies will be based on a forecast that a consumer puts into the website. Here's what I expect my taxable income to be in 2017. If it comes out that it's higher at the end of the year when you file your taxes, you pay some of the subsidy back. It's a true up. If it comes in lower, you get more subsidy on your tax return. So here are, the different types of income I'm talking about. Wages, alimony. Notice child support is not. Disability generally is not taxable. But profits from a rental, IRA distributions, pensions and Social Security, those are all, an entire Social Security are all considered part of taxable income when it comes to calculating a subsidy. Never before has insurance and your income been so tightly connected. So let's get into the specifics a bit. So there are essentially three avenues for getting healthcare coverage that will or qualify you for not paying a subsidy. Yes, you have insurance. There's no, penalty on your tax return. Medi-Cal for the lowest income Americans, or for the families, with kids under 19. There's going to a marketplace like Covered California, and then there's going off exchange directly to the health plan. For a single individual in the 0 to 16,000 range, that's squarely Medi-Cal eligibility for an adult. From 16,000 to 25,000, those are people that will be offered an enhanced silver plan in addition to premium tax credits. And from 25 to 47, they'll be offered tax credits. And above 47, there's kind of no reason to even bother with going through the exchange. So you can see, just to recap, when you're in the Medi-Cal territory, either you purchase a retail plan or you accept Medi-Cal. You can't say, no, I don't want Medi-Cal. I'd rather have a silver plan and get with Blue Shield or with Kaiser. From 16 to 25, here's where those cost sharing subsidies kick in. The deductibles are lower, the co-payments are lower, and these are really, really nice. People very happy on these plans. And then over 25, you're being offered cash money to pay your premium. Also very highly appreciated. And then over 47,000 for this single person, generally we would take that off exchange and not bother with the government at all. What do the numbers look like for a couple? Slightly higher. They scale up to where the subsidies top out at around 63,000. And I should note, these are all round numbers. Work with an agent to make sure that you know what you're getting into and what you'll be offered before you submit your application, so that, using those numbers that are much more specific. And for a family of 4, the subsidies top out at 97,000. So from 0 to 33, the adults will be offered Medi-Cal. From 0 to 60, the kids will be offered Medi-Cal. So the adults might be on a premium assistance, and cost sharing situation, and the kids are then offered Medi-Cal because if they're under 19. What are these enhanced silver plans I keep talking about? Here's the Silver 70 plan that we just talked about a minute ago. Standard. As income slides down, toward that 16,000 and above range, like to 33 or so for that single person, that consumer will begin to be offered these enhanced silver plans. So here's the way they work. So the Silver 73, you can see a primary care visit, urgent care visit goes from 35 to 30. The out-of-pocket max goes from $6,800 to $5,700. And you can see that the actuarial average is sliding downward from the consumer paying 30% on average to the consumer paying 27% on average. And as I click through these and you see, they get extremely rich. The Silver 87 plan, $10 to see the doctor, $10 to go to urgent care, $100, no deductible to go to the emergency room, when, the bill could be easily 10 times that. Max out of pocket, $2,350 for the entire year. So these are very, very, very valuable subsidies, these cost-sharing reductions. And I'll also say that there's no way for the government to recoup. Let's say that you were on a Silver 87 plan for the year, and it turns out, you had a great year with your business, and you shouldn't have been on that plan. If you had known you were going to make more, you would have put a higher forecast in, and you would have ended up on a Silver 70. They can't go back and charge you another $25 for a primary care visit, the difference between $10 here and $35 here. That's water under the bridge. You'll have to pay back premium tax credits, but you keep all the money you saved, the difference between $2,350 and $6,800. So that's just something to note. And then the very most rich plan on the exchange is the Silver 94, going to see a doctor for $5, a specialist for $8, urgent care for $5. I mean, it's frankly unheard of in this day and age. But for people whose income is very low, just above that Medi-Cal limit, they're offered this Silver 94 plan. And from my experience working with these individuals, they are very, very happy with this plan. Here's a couple of examples just to sort of bring home how much money we're talking about. For a single 30-year-old who has a total taxable income of $40,000, they choose to go on a Kaiser plan. The total premium for that plan is $312 a month because this is a young person. Covered California will pay their $109, leaving the premium to $202 for this single 30-year-old making $40,000 a year. Where does $202 come from? It's about 8% of their adjusted gross income, and that's one of the stipulations in the Affordable Care Act is that we Americans should not have to pay more than 8% of their adjusted gross income for their medical insurance, as long as they make under 400% of the federal poverty line or $97,000 for a family of 4. So it all bets are off after you're over that 100,000 mark or so, and you have a family of 4. But for everybody below that 8%, 8.5% is kind of the overall average goal. For an early retiree couple, you really see how the numbers can kick in. Their taxable income, these folks have managed to whittle down their taxable income. They're living off of some non-taxable savings in these years before they're ready for Medicare. The total Blue Shield of California Silver HMO plan, by the way, Blue Shield is offering an HMO plan starting in 2017. The total premium is over $1,500 a month. Because their taxable income is their forecast is held to $50,000, the government will give them $1,160 toward that premium, leaving them just $373 a month. So more and more, I'm talking to financial planners and early retirees who are getting very, very smart about how to structure their pre-Medicare income so that they can fit under this $63,000 cap for taxable income and make up the rest in savings, and then reap huge benefits through the Affordable Care Act subsidies. Married couple, 29 and 30 years old, with a taxable income of $30,000. They have been offered, because they're at $30,000 their income, they've been offered one of those enhanced silver plans, in this case the Silver 87. They chose a PPO. Their premium would be $619 a month, but Obamacare offers them $483, leaving their net premium for just $135 a month. Plus, they get to take advantage of the cost-sharing reductions. For a family of 3, and note I did not include a 19-year-old or below, for this family of 3 with no juveniles, their total taxable income is $45,000. They chose an Anthem Blue Cross Silver 73 plan, which they were offered one of those enhanced silver plans. Their premium would be $1,242 a month, but their tax credit is $849, and their net premium, and everybody stays together on Anthem, is $383. If this was not a 20-year-old, if this was a 7-year-old or anybody under 19, the kid would not be on this plan. The kid would be on Medi-Cal, and only the parents would be on this Anthem plan. Because remember, Medi-Cal for juveniles has a much higher income limit than for adults. Thank you for sticking with me through this complicated world of Obamacare subsidies and this webinar that was updated for 2017. If I can help you in any way and you're in the state of California, please feel free to contact me either through my email on the screen or by calling my work number. Thank you so much and have a great day.